I'm Caroline Wadman, and I'm going to be your nurse today. Before we get started, I just have a few questions about your past medical history and your family's past medical history. Do you have any diseases or illnesses that run in your family that you know of?
My father has diabetes and heart disease.
Okay. And have you had any recent hospitalizations, injuries, or surgeries?
No.
No. Okay. And are you allergic to any foods or medications?
No.
Okay, perfect. Now we are going to go over your chief complaint, which is basically the reason that you came into the doctor's office today.
I've had a sore throat for about 2 days now.
Okay. So you started feeling it about 2 days ago?
Yes.
Okay. And is there anything that provokes the pain, makes it feel worse, or?
When I swallow, it hurts really bad.
All right. And does your pain radiate to any other body part, your neck, your shoulders, your sinuses?
My neck, and I think my sinuses hurt a little bit too.
Okay. And can you explain the quality and quantity of your pain? You know, like what it feels like? Is it throbbing? Is it dull?
It stings when I swallow, and then when I turn my head, my neck hurts.
Okay. And is it always there, or does it kind of go and come when you swallow?
It's worse in the morning, but it's always there when I swallow.
Okay. And on a scale of 1 to 10, 10 being the worst pain you've ever had, what would you rate this pain?
4.
Okay. And then, so you said it's worse in the morning?
Yes.
Have you taken any medication to relieve that pain in the morning?
Just Tylenol.
Okay. And how many milligrams are you taking of that?
500.
Okay.
3 times a day.
Okay. And what do you, as the patient, think that you have?
A sinus infection or tonsillitis.
Okay, perfect. Thank you. I'm going to take your height and weight, so if you'll follow me over here. We're going to start with your weight, so if you take your shoes and socks off for me. All right, and just stand right up on the scale, feet together, stand up tall. All right, perfect. All right, 150, perfect. All right, you can step down now. You're going to take your height, so if you'll just turn around, feet together, right up against the wall, stand up tall. About 5'7", perfect. Thank you. You can put your shoes and socks on. Before I go any further, I'm going to stop and wash my hands. And I'm going to wet my hands first and make sure I use a lot of soap and, get up to the wrists and underneath the fingernails really well. And a trick that a lot of people use is they sing happy birthday to them 2 times. And that just helps them know, to actually wash their hands for at least 30 seconds. So now I'm going to take your temperature. If you can just put this right under your tongue, close your lips around it, and don't let it touch your teeth. All right, and this is one of the many places that I can take your temperature. The other places are your armpit, your ear, and your rectum. Your ear is ideal because it's the closest to the core of your body. Beep. All right. 98.2, so you don't have a fever. That's within normal limits, which is from 96 to 99. I'm going to take your pulse, and I'm going to take your radial pulse, which is right here, and I'm going to use my 2 fingers, and I'm going to place it right here, and I'm going to do it for 30 seconds, and then I'm going to multiply by 2 to get your pulse for 60 seconds. Perfect. So I got 42, so then times that by 2, and I got 84, which is within normal limits. Normal range is 60 to 100. And the force, I got a +2, which is normal. The normal range is on a 0 to +4 scale. And I also looked for the elasticity, which is, spongy and bouncy, which was good. If it wasn't, we would be concerned about arteriosclerosis. And then I also noticed the rhythm, and that's just to make sure that they're evenly spaced, and I hear the even bounces of the pulse. All right, and now I'm going to take your blood pressure. There we go. And could you just uncross your legs and place them both flat on the floor? That will just give me a more accurate reading. I'm going to make sure it's a little snug just so that will also help give me a more accurate reading. All right, and if you could place your arm flat, just like that, that's perfect. Is that too tight or is that okay?
We're good.
All right. So what I'm going to do first is I'm going to pump the cuff up and feel your pulse and make sure that I don't feel your pulse anymore, and then I'm going to let it go down again, and I'm going to pump it up again. I'm 20 past that number. Okay. So that number was 120, so now when I pump it up again, I'm going to pump it up to 140. (120/76), which is great. That is within the normal range. Gold standard blood pressure is 120/80, so that was perfect. I noted Bernadette's respiration rate during the interview when I was asking about her family medical history. I noted that her respiration rate was 18, which is within normal range. The normal respiratory rate is from 12 to 20. I also noticed that she sat up straight and did not have labored breathing. She was just breathing in and out consistently, and she had a symmetrical lung expansion.